world is in a race to develop the first COVID-19 vaccine. And the question is, who will be the first? This week on Inside Government, we want to discuss coronavirus. Joining us tonight is Professor Yeri Kombe. He's the Director General, Kenya Medical Research Institute. This will be our discussion tonight, plus more. Thank you so very much indeed for finding time to be with us. The last 1 week we have had, from Pfizer and biotech that, their vaccine is almost 95%, successful. Where are we as a country? Would we pride ourselves in releasing such numbers to the world?
Thank you very much. I think what I would start by saying is that KEMRI, and on behalf of this nation, is also in the race of developing various ways in which this particular coronavirus can be tackled. And a lot has been going on the world over. What KEMRI has been doing is developing other aspects of controlling this virus. But in addition to that, we have never lost sight of the fact that a vaccine must be developed. And in the process of doing so, we look at two aspects of more of this. One is actually working with institutions outside this nation that we have very much for a long time been collaborating with to actually continue with the progress of developing and testing the efficacy of this particular vaccine in this country and the other nations that are developing it. In this case, we have actually worked very closely with Oxford University in developing these particular efficacy undertakings or trials that we are actually working on currently. Oxford University and Wellcome Trust have been working with KEMRI for a long time, and therefore the development of vaccines, our own scientists, our own researchers have been actually in this particular race with Oxford University. And that's why when it came to testing, Kenya and KEMRI was picked up as one of those institutions that should be able to test this particular vaccine. We can say that as of now, this is with respect to the Chardoc's vaccine that has been so much talked about. We have moved quite a lot, and we have already started the trials in Kenya, particularly in the Coast Province, where one of our centers is based. We hope that this process will go on, and by mid of next year, hopefully, we'll be able to come up with fast results that we can analyze and say this is the level of efficacy that we are attaining with this particular vaccine.
And somebody may want to, want to understand, with Moderna and Pfizer plus biotech, saying that they're almost close, to announcing a breakthrough in terms of a vaccine. Of what importance would it be for KEMRI and partners, to come up with a vaccine next year?
The vaccines that we are having in the market right away, and we're talking about the Pfizer one and also the Moderna one. If you note, the very first vaccine has already been talked about with quite a number of challenges. And the challenges include the fact that this must be stored at temperatures that are -80. And this is a situation that may be fairly difficult to meet in especially the third world, where we may need this even more. And that is why this other vaccine that has come up has come with at least temperatures that it can be stored at of -20. And therefore, it is possible for this to be actually stored and used in the third world countries as much as the developed. But this is the position because in as much as we are talking about vaccines that have been developed already, the costs implications may be very high. And for this country, for example, if we came up with our own vaccine, that would be talking about cost of these vaccines that come from outside reduced drastically. And therefore, we still are working on our own. Apart from that vaccine that we're working on with Oxford University, for example, we must come up with our own vaccine that will be actually home initiated and maybe homebred, so that we can deal with the cost implications of this virus.
And apart from, participating in clinical trials, of ChAdOx1, which is a collaboration between you and Oxford University, as KEMRI, do you have your own vaccine, developed from scratch that you are working on?
For the last several months since the declaration of a first case of this virus in this nation, KEMRI actually started working on a number of things that it can do and develop internally for fighting this virus. We have been dealing with test kits that we are already aware of, and we have been talking about this quite a lot in the media. These test kits are at advanced stages of development, and we want to say here for sure, particularly the PCR kits that we have been importing, and the cost implications on this also have been fairly high. So our own development of kits in here will actually tone down the cost of the prices of these test kits that we're buying. But at the same time, we have been working on possible drugs that can be used against this virus, but even more, vaccine developments. We actually have already developed our own viruses that it's not developing really, it's culturing, growing our own viruses that actually have been isolated from some of our patients in this nation. So we have been able to grow this, and we have them in our laboratories. These viruses will help us actually to continue to develop vaccines that are specific to the viruses that we find in this nation, and that is in progress. Basically what we're doing is we continue to actually source for other agents or reagents that will be used together with what we have developed already to continue to develop this particular vaccine that is basically on its early stages of development. So we are actually working on that as much as possible, and we actually must say also it is not only KEMRI that will be doing this. We are also working closely with other nations, and particularly the Japanese institutions, to see how we can continue to develop this further until we attain a vaccine that is actually home initiated and developed.
Apart from the development of a vaccine, this is not the only component that is required or that is needed, in the management of, viruses. And I'm not just talking about, COVID-19, but in specific to coronavirus. What other developments or milestones have we covered in the process of helping to try and deal with the coronavirus? I
want to take you back to the very first time we had the first case of coronavirus in this country. That time, of course, we did not know that we were even prepared ourselves as KEMRI against this virus. And the certain developments or products that we already had in KEMRI that we came to establish, yes, these ones will be very useful in this fight against coronavirus. And I can tell you that some of these are the alcohol-based hand sanitizer. We had started working with this, and we developed this about 5 years ago. We were using it for sanitization in the usual way. But when we had this first case and many others that followed of coronavirus in this nation, and the demand for the hand sanitizers was up, this is where KEMRI actually went full throttle and continued to develop and increase the outputs or the production of this particular hand sanitizer. So we can say KEMRI, with its own developed hand sanitizer, has been able to support this particular country in the fight against this coronavirus. The other thing that we have done which of course is also very important, is the development of virus transport media, the ones that we call VTM. There's a time, in a few months after the time that we had the first outbreak, and testing for coronavirus was going on around everywhere in this nation. We ran out of the virus transport media, which initially we were importing from outside. That is the time that our scientists came together very quickly, and it was not available anywhere in this nation. We started, we developed that, and we started producing this particular transport media, which is what we actually are supporting this nation with to date. Of course, there are others that came in and others that were imported later on, but we can say we actually have the capacity, and we have a lot of stocks of virus transport media that can be used anywhere. And we continue to improve this to make sure that it is available everywhere and in this nation, and even for export purposes. The other things that I can say for sure we have been doing is those test kits that I talked about a little earlier. We have the PCR kits that we have, which is very much at an advanced stage. And I said in the next few days, I don't want to say even weeks, in the next few days, we're actually amplifying and finalizing the accuracy in the terms of diagnosis or diagnosing of this particular kit. We're also evaluating it with other labs, including our own in this country. And we believe in the next few days or weeks, this kit should be ready for use in this particular nation. So we look forward to that happening very soon. So that is the other item that we have actually been working on very hard, and we will be able to use in very much the near future. This is now without mentioning the vaccine development that we are working on very hard. And we know this one also sometime, right, I don't want to say in the very near future, but soon we should be able to come up with our own here, together with other collaborators that will be able to develop in here, and not forgetting also the drug development and the tests and trials that we are also working on. So this is basically in a nutshell what we have been doing, and we continue to do to actually to the fight against this particular virus.
You know, for an institution that has been there since 1971, so we're talking about 41 years. And when you look at your research budget, I mean, almost 92% of it, you know, comes from donors, you know, and from grants. Definitely, this is not good, you know, because we say, who pays the piper calls the music. How do we ensure, you know, that as a country, I mean, we devote so much resources, you know, into research funding to ensure that some of these challenges, you know, that we deal with as a country are addressed, you know, by domestic solutions?
I agree with you fully when you say whoever pays the piper calls the tune. This is exactly what happens. Those projects that are actually advertised for KEMRI to bid alongside other scientists globally come with specific agendas. And these agendas are more inclined to those that are funding it than actually us in this nation. And I think this is a call that we probably would wish to send out there. That the research budget, and we have already actually communicated this to our government severally, and I know that is actually in the process. And I want to quote here His Excellency the President of this country, Uhuru Muigai Kenyatta, did in his announcements recently. He said that he is looking forward to increasing the funding of the research institutions. That is actually, I think, a commitment that we need actually to continue to encourage. I know we have been actually knocking at the doors of the National Research Fund. This is a fund that has been established to actually fund research in all research undertakings in this country, and not only health. So basically, for this one, we are fighting together alongside any other research institutions in various other disciplines for this funding. And ultimately, the fund that comes to KEMRI for research in health is usually also very small. So this actually is a situation that needs to be addressed, and it is my appeal to our beloved government to go ahead and with the support that they very much have been talking about, so that KEMRI is able to get out of this dependence that we have had on funding that comes from outside with those specified agendas already. They're inbuilt as they come. And therefore, even if we bid, we're very good in research. That is a fact. And that's why a lot of that funding comes to KEMRI. But if we can do it and those people are pleased with us and give us funds, I think if we got funds not necessarily in the same amounts that we are talking about, but at least incrementally funding that is going to increase our own research and our own supporting our own research agenda, that actually will go a long way.
So, with such skilled, funding, whereby you have an institution that is involved in, the research of medical systems and products, where you have a situation where 25% of the budget, that comes from the exchequer is basically used for recurrent expenditure. So how then, as a country, do we aspire to become part of the competitive global research community?
I want to agree with you on the issue of a huge percentage of the budget for research in this institute actually comes from outside. These are grantors that actually do provide this funding for research in this institution, and this has gone on for a long time. I probably should state here our budget annual to this date is about 8 billion. And out of that, about 75% of that is funding that actually comes from outside this nation. And the rest is what we get from our own government. And a lot of this is for emoluments. And yes, that's basically recurrent here. Now, the rest is what comes in from outside. And that is what actually we used largely for the research that we undertake here. And I want to actually also confirm that our institute here is one of those institutes that bids very heavily alongside all other scientists globally for these adverts that come up for funding and grants. And I can assure you, KEMRI is amongst those leading institutions. And if it is for this particular continent, Africa, KEMRI is actually leading on its own for the attraction of funding that actually it is able to from those grantors outside.
What do you think would change if you have 100% of your budget, being funded by Kenyan Exchequer?
And when we talk of 100%, we are talking, for example, to start with, the entire budget that we are getting annual now. Yes. I think that...
You said your budget would be...
it's 8 billion, but of course we are worth much more. We are worth much more. There's a lot that we are doing with the funding that is coming from outside that is also limited to a great extent. But when we open up the funding, also the researchers open up their thinking and their engagement, and therefore research becomes even much more. And of course we are talking about equipping these research facilities. We are talking about paying these researchers well, retaining them so that they don't actually go out there and do the same things that they would have done there, even better out there and supporting those entities outside this nation. So there's a lot more that I can assure you KEMRI will be able to do and be able to actually come up with than what is happening at the moment.
For an institution like KEMRI, which is very critical in the health sector in this country. Do you feel that it is being given the due attention that it deserves?
But as I said a little earlier, we can do better. With a little more funding to this institute, a lot of the equipment that we say we are actually using, which we know are actually the top-notch equipment in research that we're using, still these ones continue to actually go off the market and of course are relatively obsolete. Then we need to keep on renewing the modernity of this equipment in this institute, continue to train our scientists in modern use of facilities that actually are elsewhere, and this way I think that will make KEMRI to continue to shine out there. I will give you this very good example. Last year, 2019, KEMRI was rated topmost in the African continent. I believe you are aware of that, by a renowned and reputable organization that deals with these particular ratings. It is KEMRI that was rated ahead of any other health research institution in terms of health outputs or health research outputs in the entire Africa. So that recognition is because of the support that we have been getting from our own government. And I think a lot of the members of the public have actually come to identify KEMRI with research and also answers to health questions that actually come up.
For the last 41 years, of KEMRI's existence, I mean, we have never come up, with a homegrown vaccine, with a homegrown drug, that we can use to deal with the myriad of challenges, that we face as a country. How do we ensure that the next 41 years will be different?
Well, I want to say for sure, probably I will not be there to launch this particular vaccine. Yeah. I probably will have already exited. But the efforts that are with our scientists now, and I want to assure you, and any time, when time allows, you should be able to interact and also see what our scientists are doing here. The younger scientists that have come up with these ideas, other than working out there with these other institutions that are involved in developing these vaccines. We can actually initiate our own processes, and that's why I told you, even the development of the vaccine against COVID-19, this one has started with the younger folk that actually are scientists that have come into the picture. Now, what we need to support them with, and definitely so, is to support them with the necessary equipment. And you cannot say that you have been trained and that is all, you know everything about the development of vaccines and you don't need any more of that. No, continuous training and continuous interaction with those institutions that are already ahead and being able to do this is also very important. So the funding for their training, the funding for the equipment, and supporting them with this necessary needs that they have in continuing to research and developing vaccine, this is a very important thing. And I can assure you, having started now, and there has never been no other time that KEMRI has so much featured in an effort or have wanted to develop a vaccine like now. And thanks to COVID-19, this has been initiated, and many other things that I've just talked about, including the drugs. And we are working very hard to continue to equip these scientists with the necessary equipment and also training to be able to move on. So this is actually the environment that we need for our scientists. And I can assure you, these scientists are capable of doing as much as any other institutions out there that are doing so.
As we were in our engagement, tell me this, about 2-3 months ago, the Russian Federation announced to the world that they have managed to develop, their own vaccine, the Sputnik 5. The world has not talked so much about this, as we have seen, Pfizer and Moderna, being discussed. have we thought about, approaching Russia, to purchase, Sputnik 5 and see how effective it can be on our people?
Well, I may not be able to say a lot about this particular vaccine, but I'm aware that every nation, if not most of the nations globally, have been working towards being fast in developing their own vaccines. And I can tell you for sure this has been a rush. This has been competition. Whoever does it fast and it's effective, that is at least a big plus. For those nations that we probably have very little information about, I can tell you for sure, very little information about the vaccines that have been developed in Russia, and probably to some extent the Chinese vaccines that either under development have already been developed. And again, India, you are aware also, India is doing a lot of work on that. And at one time, we actually had been working a little with Indian farms, at least to see whether we can also try their vaccines in this particular nation. They are actually at some kind of advanced stage also in developing their own vaccines.
Finally, Prof, where do you see KEMRI by the time we get to Vision 2030?
We know that apart from doing our own research, we have engaged ourselves in training a lot of other scientists in the region, and I can say for sure in the region, huge numbers of people have been trained in this institution from other countries around here. And this we expect to continue to happen in the coming years, but over and about that, to be able to be leading in this ability to produce vaccines, to produce drugs, to develop other diagnostic kits for whatever problems of health that we in Kenya we face. And I don't look forward to us importing a lot of these diagnostics, medications, vaccines in the next 10 years. That is my vision.
Thank you very much. We look forward for that kind of a vision, and we look forward for such kind of a KEMRI.
Thank you. Thank you very much.
Professor Yeri Kombe is the Director General, Kenya Medical Research Institute, joining us on Inside Government tonight to help us understand what is the role of KEMRI in the development of vaccines, not just COVID-19, but other vaccines, like HIV and so much. And you have heard it from him, apart from the challenges, that they face, the challenges of funding and so much. There is a lot that they are doing as an institution to ensure that as a country, we are on track to becoming a #1 research institution, not just here in Africa, but around the world. My name is O'Brien Kimani. This has been Inside Government. Thank you for your time. We'll do this again on Thursday, same time. Have a good night.